All right, welcome. We are on the air. This is Christopher Moyer coming to you from Denver, Colorado, and I am joined by Tammy Hicks coming to us from Texas. How are you, Tammy?
I'm fine, thank you. How are you?
I'm good. Thanks for joining us. Tammy and I are going to be discussing a research article today entitled Music-Induced Analgesia in Chronic Pain Conditions, Systematic Review and Meta-Analysis. And this is from the journal Pain Physician, and it was published last year, 2017. A link to this article is available from my Patreon site. And if you go over there, you can also, if you're feeling it, contribute to supporting this program and the development of it. Let me tell you a little bit more about Tammy before we get into the article. So Tammy, you're actually pretty new to massage therapy, is that right? Before I read the information I have here, do I have that right?
Yes, sir. I started in July.
You mustn't call me sir. Did you just call me sir? All right, let me read the intro. No, sir. Come on now. Following 26 years of experience working as a geriatric palliative caregiver, Tammy Hicks changed direction to study sociology and became a trauma therapist for veterans, a decision that reflected her background growing up in a military family. During the course of her studies, she discovered how beneficial massage is for so many of the issues veterans face and became a licensed massage therapist on July 11th, 2017. I thought it was interesting that you included the specific date. She also mentions that same day she obtained her license, she became a Hands for Heroes partner and has been learning about and loving massage every day since. And you alerted me to a link, handsforheroes.net, which has more information about this program. Do you want to say something about it?
First off, I was in school to become a trauma therapist, but I haven't finished yet. I stopped school to do massage therapy.
Okay.
The Hands for Heroes program is a network of over 1,100 body workers who give their services to veterans. We just volunteer. We choose a predetermined number of veterans to serve at a predetermined number of services for a predetermined number of time. And so we make up what we can give. We don't have to raise money to do this. We just volunteer. But as part of this network, veterans and active duty people can go on the Hands for Heroes website and search for a provider in their area.
Nice. That's terrific. Your interests align, it sounds like, a lot with mine, and also with my friend Raven Sarah Trevelyan. So, I mean, your interests align with mine in that I'm really interested in treatment for depression, anxiety, pain relief, trauma-related things more broadly. And then my friend Raven Sarah, who you probably know from interactions online and such, is among her many interests, veteran care, especially as massage therapy can be applied to it, is something she's interested in as well. Have you conversed with her online? I bet you have.
No, I haven't.
No? Oh, okay. I'll have to put the two of you in touch. I just kind of assumed that because we're involved in so many of the same discussions. So I'm going to ask a question here that I already know the answer to. So undoubtedly, you use music in combination with massage therapy when you're treating folks, correct?
Yes.
Yeah, and I mean, it seems just to be like standard among massage therapists to do that. So the thing we're going to be looking at today is directly applicable to massage therapy. In addition to it being directly applicable to massage therapy, I think it also gives us some opportunities to think about treatment research more broadly. A lot of the conceptual problems a researcher would encounter studying this issue are the same kind of conceptual problems one would run into studying massage therapy as the independent variable of interest. So this conversation can go in all kinds of interesting directions, as I'm sure it will. So shall we begin with me putting you on the spot and asking you to describe what it is they did? For new listeners, one of the things we're doing here is we're starting to organize this program according to 5 questions. Those questions being, what did the researchers do? What did the researchers find? What are some of the strengths of the study? What are some of the weaknesses or limitations? and what are the implications for practice. So the first one we've got is, what did they do? You feel equipped to kick that off?
Okay. I'm a little nervous already.
Nah, don't be.
But what they did was they studied, they broke it down. The 14 studies that they actually used covered 1,178 patients, and they compared using music as a pain analgesic with tactile touch, with, get my notes here. I'm sorry. I got nervous all of a sudden. I'm so sorry.
You're doing fine. You're doing fine. While you're looking at your notes, I'll just say that everything you've got so far is right. So they did a meta-analysis. And
So
go ahead.
they used tactile touch and conversation and routine care and no music, and then compared it to using different kinds of music like Tchaikovsky and classical music, ambient music, and they used it for, primarily they studied patients who had cancer pain and fibromyalgia, and then they also used it with other patients that were kind of secondary in the study, were patients who were in palliative care and had osteoarthritis and non-malignant pain issues, as well as inflammatory bowel issues.
Right.
Am I kind of what you want?
I mean, right all around. I mean, so if I can just add a little detail to what you've said, all of which is correct. These researchers are investigating the question of whether music might provide pain relief in conditions of chronic pain. And to do that, they set out to review all the previous research that they could find. So that's where the number of 14 and then 11 studies that you were mentioning came from. So these researchers didn't do the studies themselves. They did a broader study of their own in which they drew on these individual studies that they could find and put them together to say, what can we determine in general about whether music reduces chronic pain? Does that align with everything you said so far?
Yeah.
Okay. And then, as you noted, because there were several individual studies included, while they were all the same in some respects, they all looked at massage therapy as an independent variable, and they all looked at reduction of pain as a dependent variable. They were also really different in a lot of ways. So the kind of control groups that they used varied. In some cases, the control group was standard care. In another case, the control group was listening to a metronome. In another case, it was receiving, I don't think there was a case where they received manual therapy, or there was one where they got some stimulation of like acupressure points. Do I remember that right? Do you remember that?
Yes.
Okay. So the broader point being the control groups varied across the studies. And in fact, all kinds of things varied across the studies, the kind of music they used, the timing, so on and so forth. But the thing they all had in common was that they were randomized controlled trials, all the studies that were included. That's a fancy way of saying there was a treatment group and a control group, and the subjects were randomized to be in one or the other. And the question of interest is whether music reduced pain, or specifically chronic pain associated with these conditions. And then they also looked at several other things, like whether massage also reduced, or whether music also reduced anxiety, depression, whether it made a difference if the patients chose the music or the researchers chose the music, some other things like that that we'll probably talk about as we go. So we've got a picture of what they did, and they combined all these results. Do we need to say anything else about what the researchers did before we move on to saying what they found? Should we say more about what they did?
No, I think we pretty much said it all.
All right, that's good. Actually, let's say one more thing about what they did, because I'm going to want to bring this up later. I just remembered now. So one of the really important things when you do a meta-analysis, and I've done some meta-analyses, so I feel justified in saying this. It's really important to have an operational definition for what it is you're studying. So when I was doing meta-analyses related to massage therapy, one of the challenges we ran into is, what is massage therapy? Okay, this is really important because it helps determine what studies you're going to include in your meta-analysis. So, you know, if somebody's getting very gentle touch just to the shoulders, and that's all they did in the study, is that massage therapy? If they're getting gripped and kneaded on all different parts of their body, is that massage therapy? So you have to come up with a definition, and it has to be an objective definition. It has to be one that you and I can share and look at. It can't be just in my mind what I think massage therapy is. It's got to be objective and transparent so that anyone who reads the study knows exactly what you were thinking. Well, the same thing applies here. Did they ever really define what they're considering to be music?
No, they didn't. Because what they were saying, we used all these different things like the metronome and ambient music and classical music, but they didn't say this is the music that we use. It was just kind of a hodgepodge of all different kinds of noises. And so,
yeah, I don't know if I'd say noises. I mean, I don't know if I mean, I don't want to. I follow your general meaning, but I'm not sure it's just noises. I mean, I do think that all the things they included would qualify as music, but they weren't specific about what that means. They did tell us a little bit about, you know, studies included classical music, another study included some Tibetan music, another. So they give us some information on what was in there,
but they didn't define it.
Right. They didn't say, here's what we're going to consider to be music.
Right.
Let's be a little bit absurdist here to make the point. So if they had found a study in which patients were subjected to Norwegian speed metal, would you include that in the meta-analysis? I mean, seriously, I mean, that's music, and that's music that some people like. And, you know, it can be really good to ask slightly absurdist questions like this to flesh things out. You know, would chronic pain patients experience pain relief if they were listening to high volume Norwegian speed metal?
Well, and that goes into the patient choice of music that it discussed.
Yeah, it does, doesn't it? Yeah. So we're going to say more about that as when we talk about what they find and what some of the strengths and limitations are. But let's just kind of put that out there right now. It wasn't entirely clear how they were defining music. And I think that's, yeah, we're going to want to say more about that. All right. So now that we've talked about that, what did they find?
They found that for pain, that music seemed to have a moderate effect in relieving pain, and for chronic pain, and that's what we're talking about here is chronic pain. Mm-hmm. But they found it to have a high effect for relieving, you know, depression and anxiety.
Did you get the impression the effect was stronger for depression and anxiety for pain? They looked similar to me, but I'm checking my notes now to see.
Well, you know, when it was first talking about it, mm-hmm. It said that, well, okay, let me go back and clarify, because it was talking about that they were, you know, moderate for pain, depression, anxiety at first, but then later on when it was talking about it, it seemed to me, and I might be wrong because I'm not real good at, you know, this yet, but it seemed to me that they were having a little bit better effect with depression and anxiety. But I might be wrong on that.
No, I don't think you're wrong. I mean, I think it's a matter of interpretation. My interpretation was slightly different. So why don't we let's be more specific here. So their main finding was, it sounds like you got company.
No, that's Ripley being upset because Rainbow's in his chair.
So you do have company.
Yeah.
Pets are welcome on the program, as we mentioned before we went on air. Okay, so what did they find? Well, they did several different analyses, but the main finding is that music appeared to reduce chronic pain across all the studies. And they give some statistics for this. And the statistics are that the standardized mean difference was 0.6 of a standard deviation. And they give a confidence interval for that that shows that this was a statistically significant result. Okay, what does that mean? So, excuse me. That means that the people in these studies who listened to music and assessed their pain following music versus the people who got standard care or some other comparison, the people listening to music reported less pain at the end of the intervention. And furthermore, yes, they reported quite a bit less pain. 0.6 of a standard deviation to a statistician, to a scientist who's familiar with that kind of terminology, that's a pretty impressive effect. That's in the, by standard ways of thinking, that would be a medium to large effect. I was surprised by the effect size that they reported. So we'll start just talking about the music part. And then they broke that down in several different ways. They said, what if we just look at this type of pain? What if we do this, that, and the other thing? And the general pattern of results I found was pretty consistent. I didn't find the sub-analyses to be all that interesting, really. I'd rather talk about the main result. So 0.6 of a standard deviation. And as you noted, they also, in a smaller number of cases, were able to look at the effect on anxiety and on depression. And they had similar effects to that, although based on a smaller number of studies, about 5.5 or a little more than half a standard deviation reduction of anxiety and about 0.8 of a standard deviation reduction in depression. These are pretty large effects. In fact, I was surprised by that, the size of them. I wasn't surprised that there was an overall effect. I was a little bit surprised by the size of them. Let me ask you, still related to the results, how did you find, have you read meta-analyses before, or was this the first time you were looking at a study like this?
I've read only about 3 or 4 of them before. So I'm not, again, really experienced with it.
No, you're super experienced. 3 or 4 is like 3 or 4 more than most massage therapists have ever looked at. You're like nearly the top of the pyramid for that. Yeah, no, you get a pat on the back if you've read 3 or 4 meta-analyses. You're way ahead. So good for you.
Well, it was in reading the first meta-analyses during my studies when I found massage therapy to be so effective for veterans. That's how I discovered it.
Okay, cool.
And then I had to research it some more. So that's, I found it interesting whenever it was talking about in the results, talking about, pain was, I lost my thought. I'm sorry.
That's okay.
I lost my thought.
I'll babble about something and maybe it'll come back to you. So one of the reasons I was asking you about other meta-analyses is I was wondering, as you looked at this paper, if you found the graphics to be clear and interpretable, or if they looked kind of like hieroglyphics or somewhere in the middle. How did you find the graphics? Hmm?
Somewhere in the middle.
Somewhere in the middle. Okay.
The one, yeah. I liked figure 1, this one. I liked this one.
I'm pulling up the paper right now on my computer, and I think maybe, so you were saying there's table 1. Which one do you want us to try to look at?
Whichever one you want to.
Well, I was asking you.
Well, I like this figure 1, the flow diagram.
Okay. That shows how they determined which studies would go in. It's kind of like, okay, right. So
it makes sense.
Okay, so that's a very common graphic in a meta-analysis. It tries to show the process by which we started looking at all these studies, and then we winnowed it down to these, and then we winnowed it down to these. So you found that pretty intuitive.
Yeah, that was helpful. And then this figure 4, where it talks about music effects on depressions across all studies. Mm-hmm. Now, I like this where it had all the numbers here, and it had the little graph.
So let's look at one of these. So I'm going to pull up figure 2. So figure 4, there's about a dozen figures here that are outcomes, and they're all in the same format. So let's look at the main one, which would be figure 2. And I'm going to take a moment here to try to get it to share screens with you. And
okay.
Let's see if we can do, oh dear, I need to, here we go. I need to put this away or we're going to have like an endless loop. So I'll need you to tell me, what are you seeing right now? Because I can't see the screen. Are you seeing the paper? Okay,
yes,
great.
I see figure.
So let me make this a little, this is going to be hard. Okay, here we go. Okay, so figure 2 is centered on the screen now. And the reason, good. So the reason it's worth pulling this up and spending a little bit of time on it is this is the kind of thing that someone who's new to research, they might get to this and go, oh dear, you know, what is this? I have no idea what's going on. And someone who's maybe a little more experienced with research, the fact is this picture here, this is the whole study. Like, this is all you really need. This is everything here. And if you know how to look at it, and it's actually not as complicated as it looks. So, and I'll, you know, if you've looked at meta-analyses before, you already have a sense of what this is. I'm just going to go through a couple things for people who are viewing to help them understand this. So what we've got here is these are the individual studies listed by author name and year of publication. Okay, so alparicin is a study that they included, and this is the data about the endpoint for the people who listen to music and the endpoint for the people who did not. And this shows how the study was weighted in the meta-analysis. This is all important, but we're not going to get bogged down in this. This over here is what I want to draw your attention to, because this tells the whole story.
Yes.
So what this is showing is it's saying the standardized mean difference, that's the effect, for the independent variable with the 95% confidence interval. So our axis here is the effect size. And depending on the meta-analysis, depending on the way they've set it up, you might want the number to be negative, you might want it to be positive. The only thing that's important is that you understand what they're saying. And so in this case, they're saying if the music condition did better, we're going to conceptualize that as a negative number. In other words, it means your pain, if you're in the music condition, tended to go down versus the control group. That makes sense, right?
Yes.
Okay. And then for each study, they've got a graphic here. They've got a dot, and that is the mean effect in this study. And then these little whiskers coming off of it, and that is what statisticians call these whiskers. That's showing the amount of spread in the data in that particular study. If a study is really large, if it has a lot of subjects in it, you might see much smaller whiskers because it's a more powerful study. They've got a more precise estimate of what the effect was. A smaller study might have a wider range, which means their estimate of what's going on is less precise. And then one other thing is, if that whisker goes over this line here, this 0, we've all heard about what statistical significance is, but sometimes it's a difficult thing to understand. Here we've got it represented graphically. So this study, on average, the people who listen to music had less pain, but the results were not so strong in this study that it was statistically significant. Because this whisker, they're saying it's possible that the effect is on the other side of this line. It's not likely, but it's possible. Does that make sense?
Yes.
Cool. Okay, so now we look at the pattern of this, and you know, what would you say about the pattern of this if you were going to describe it?
Well, I would say that, I'll hold my hands. I would say that the majority of the studies were pretty strong, but then you had some that had the
well, just the overall pattern first. What's the main thing we see overall?
That the studies seem to be stronger, that they favor music.
Yeah, yeah. Every one of these studies, not in a single case, is the estimate of effect to the right of this line. They're all on the left side of 0. So in every case, music appears to be reducing pain, sometimes a little, sometimes a lot, but there are no lines over here, right?
Right.
Okay. So we've got consistency, and that's one of the things that you look for. You know, if there were lines all over the place here, that would lead us to think, well, there's probably no average effect. So then we come down here, excuse me, and this is a statistical average of all these different studies. And this little diamond is saying when we average all the data in these studies, it appears that massage therapy or music, it appears that listening to music reduces pain about 0.6 of a standard deviation. And there's some variability around that, which is estimated by this confidence interval. But notice that there's no indication that statistically we think the effect is over here. In other words, they're saying we're quite confident that the effect is right in this range. So, and the logic we've just applied to this is the same for every one of these graphics. They do it for anxiety, they do it for depression, and I don't, you know, now that we've illustrated that, someone who wants to look at this study can get an idea of what that is. I'm going to go back to, I'm going to rejoin the broadcast here, if I can do that, now that we've described what we've got. Let me see if I come back. All right, I'm back. Welcome. So, yeah, in a meta-analysis, so that kind of graphic is a very conventional way to display the results of a meta-analysis. And once you've got some understanding of what it is, I mean, there's more there. We could get more complicated than that, but we really don't need to for present purposes. So that's what they found. Now, what about the strengths of this study? What would we say are some of the strengths of this study?
Well, I would say that for me, what I found was the main strength of the study was that it had a lot of diversity in that they didn't cross over, you know, like the studies didn't study the same people or the same samples over and over and over again. So that was good. They had some that crossed over, but not an overwhelming amount.
But one of the strengths you're saying is the studies looked at different aspects of chronic pain and different aspects of music.
Yes.
Okay, agreed. And a note is you're using the word crossover, and we're talking about similarities in the studies. So it might be important to mention that these studies are independent of each other. That is, they don't have the same subjects in them. They're independent studies.
That's what I was trying to say. Yes.
Oh, okay. Okay. So that's important. I agree with you, but actually thinking of it as a researcher, I think that's also a weakness. The fact is I'd like to see a more focused, if it was possible, I'd like to see them focus more specifically on a condition and on a particular type of music intervention. So, you know, that can go either way. So I'm not disagreeing with you, but I'm kind of adding that there's more than one way we could look at that. So, okay, so there's a strength. Anything else you want to add to the strengths column for this study?
There wasn't a lot of the risk of bias was pretty low, and I like that.
Okay, so yeah, they do an analysis of what kind of validity threats there might be in the individual studies, and they give an accounting of that. So that is a strength. I would add in the strengths column, you know, meta-analysis as a method tends to be a very strong method, especially if you do a very good job at it. You tend to get all the available data that's out there. You give a really good overview of the field. You end up showing not only what's known, but you tend to implicitly show maybe what's not known, like what kind of things haven't been studied or what kind of things need to be filled in going forward. So I would say that, you know, one of the strengths of this study is the method of meta-analysis. Another thing that I would put in the strengths column is their use of graphics is good. It fits with meta-analytic conventions, and, you know, once you spend a little time looking at the graphics, you can get a pretty good understanding of what they did and what they found. So I would put those in the strengths column for this study. Which brings us to the much juicier question of what are the weaknesses and limitations of this study. So now we get to express ourselves. So what do you want to start us off on that?
Well, I feel like that one of the weaknesses, as we discussed earlier, is that they did not define what music is.
Mm-hmm.
To me, as I read the article, the first time I noticed that, I also feel like, and even the researchers agreed that, they didn't have a good control, because you can't really blind the study or it'd be very difficult to blind the study. So you can't say, well, white noise versus music, because then people are going to know that they're not listening to music. Well, you know what, though? Since they didn't define what music is, how are they going to know? You see what I'm saying?
No, I agree with you. I think so. There's actually several things at once that you're bringing up. So everything you're saying is correct, but we might want to unpack it a little bit more. So let's save that first one for later. Let's save the operational definition problem for later, because that's a really juicy one. Let's talk about this issue of comparison and control. So if you want to know, does music reduce pain? One of the things you must ask is, in comparison to what? So oftentimes when people are new to looking at research, they might say, well, what do you mean? This is easy. Take people who are in pain, have them listen, measure their pain, have them rate it, have them listen to music, have them rate their pain again. And anything that happened in between is the effect of music. And that sounds like it would be right, but scientifically it's not right. And the reason, there are a lot of reasons it's not right, but some of the main reasons are people and conditions change with time naturally. If you take anyone who's got a high level of pain and you just wait a while doing nothing, on average, their pain is going to go down. So, and people might be saying, well, you don't know that, and you can't be sure. Yeah, we actually, on average, we do know that. We don't know what's going to happen in any particular case, but there's a bunch of reasons. People's natural healing processes, a measurement artifact known as statistical regression, more things than we'll be able to go into presently. There's a bunch of reasons why just measuring a before and after effect is not accurate or informative. You have to compare it to something else that uses the same time course. So now you've got a problem, which is, to what are you going to compare? Are you going to compare it to standard treatment? Because that might give you the purest look at what the effect of music is. Or should you compare it to something that has some characteristics of music but isn't music? Like, should you have people listening to a metronome or some other kind of standardized sound? Because music isn't just sound, it's sound organized in a certain culturally endorsed way, and I would have a hard time defining it, but you run into this difficulty of, to what should we compare? Is that part of what you were getting at?
Yes, and they even mentioned that in the study, that maybe they could compare it to, say, listening to an audiobook.
Yeah, that's an interesting, and that's an interesting comparison, which opens up other problems. So on the one hand, you would be comparing music to something someone is listening to that's not music. On the other hand, what if listening to audiobooks reduces pain really well? That might obscure the effect that music has.
Right.
Yeah. And then
it's hard to compare.
It's really hard. It's hard to select the comparison. The comparison itself is not that hard, but selecting what would be the most scientifically useful comparison, that's hard. That's really hard. And as I was reading this article, I was thinking back to my time teaching introductory psychology courses, especially the first course in research methods. So this is when you're meeting with students who are sophomores, maybe juniors, and they're going to do maybe their very first entry-level research project, And anyone who is taught this level of psychology more than once will tell you that the thing that students want to research more than anything else when it's time for them to think of something is, I want to see the effect of music on, and it might be studying or test results or, relaxation, or everybody loves music, and it's one of the first things they want to think of. And this is like the best example of something that to a student seems like a great idea, and to an experienced researcher seems like a terrible idea. And the reason being is it's so complicated. What music, what tempo, what volume, rooted in what culture? Will it be music that's familiar to the person or new to the person? How are you going to control all these other variables? What are you going to compare it to? And so once you've taught psychology more than a couple times, you actually, a lot of psychology professors just prohibit that as a subject, not because we hate music, but because we have thought about how complicated, unbelievably complicated that would be. So I was thinking about that as we were looking at this study. Figuring out what you're going to compare it to is just an endlessly complex problem. And it's even more complex when you're doing kind of real world research. So if you're doing laboratory research, it's not, you can do something very specific. You could say, okay, we'll have people listen to a piece of music, but in one condition, we'll have them listen to it at high volume and another at low volume. Or we'll manipulate the speed. Everything will be the same about this music except the tempo. And that way we'll hone in on what the effect of the tempo is. But when we listen to music, we're taking in so many variables, right? There's our experience with music. There's the tonality of the music. There's the tempo of the music. There's the volume of the music. There's whether we're receptive to the music at that moment in time. This is another thing I was thinking of. So not only does this study not define music, there doesn't seem to have any consideration of the possibility that music isn't uniformly positive, right? So again, here's extremes. Think about times in your life where you've been subjected to music and you didn't want to be, right? So from my own life, way back when I used to work in a retail environment, and the music system would play the same horrible, 20 tracks every day.
Yes.
It was horrible. Yeah, you'd do anything to turn that off. Or you're in the car with a friend who has no taste in music, and they're like, "Oh man," and they're like turning up this horrible music, and you want to jump out of the car while it's going 70 miles an hour. Or and here's the most extreme, ridiculous example. Back when the U.S. was trying to drive Noriega out of Panama, they blasted his house with high volume music. So you can use music as torture, right? So which illustrates that music is not always positive. So that's interesting, I think.
Yeah, and that's where it goes back into the study where they talked about patient chosen music as compared to the music that the researcher chose for the patient, and how the effects were greater when the patients actually chose the music. And it addressed the issue of familiarity. Is it a comfort because the music's familiar, or, is it really working because it's music?
Mm-hmm.
They didn't define it, but they did at least address that.
When you're using music in your practice, do you let the recipients choose the music? Do they ever bring it in? How do you manage that? I do it both ways. Okay.
I have one client who has Asperger's, and I let him choose the music because I was using music, but everything's very a lot of sensation overload when you have somebody who has that issue. And I know that this hasn't anything to do with pain, but this is just one example. Oh. And so, getting him used to touch and what have you, at first, because we didn't really know what to do, I chose the music. But then the next time I said, hey, if you have a favorite music, why don't you bring it? And so he did, and the effects of massage were greater when he chose his own music.
Interesting.
I have one veteran that I work with that she brings her own music because we've tried several different types of music. We tried ambient music, we tried classical music, we tried your spa music, and with her. So I'll let her choose her own music.
What would you do if one of your patients or clients brought in music that they loved and was going to be good for them, but it turned out to be music that you really disliked? How would you work with that?
I actually don't like the music that my Asperger client listens to.
How do you manage that then?
I breathe and focus on the tissues.
Okay.
And pay attention to his response. I tune it out like you do the music at the retail center.
Okay.
I just tune it out. But what I do find, however, I want to address this, is that the vibration that the music creates, because in my room I use a stereo, I will get going kind of with the beat. Even though I don't like the music, my movements follow the flow of the music.
Interesting.
So it's kind of like a weird metal type of music that he listens to.
Yeah.
Which you don't get a lot in massage.
Yeah. There are some notable exceptions, though. I've talked to a few people who really do like to use heavy or metal music. But anyway, go on.
But I find that when I can tune into what he's doing, you know, and his tissue response, then I can just kind of flow with it.
Interesting.
There's some music that I have, you know, on CD that some of my clients just absolutely love, and I'm kind of tired of it, but they'll say, hey, can you play that one with the ocean in the background? And so I do. And
yeah. So you're talking like the kind of spa music that you've heard like 10,000 times, right? You're just like enough already. But yeah, but the person on your table is like, that's relaxing. I want to hear that again.
Now, me personally, my favorite music to use during massage is tribal belly dance music.
Yeah.
Because that's my kind of music. And I have a couple of clients that really like that, and we really get into it. But for the most part, I just do whatever my client is in tune with.
So let me ask you this. First, let me make sure I heard you correctly. Did you say tribal belly dance music?
Yes.
Okay. If you were going to speculate, what are the characteristics of that music that make it good for the work you're doing?
Well, for me, I use it when I'm doing a lot of, when I'm trying to give, like if somebody's feeling drained, energy, and their body is just tired, and I use the tempo and the beat that I can kind of go with. It's very upbeat, and got this strong upbeat tempo, but then the music, like the melody, flows.
Okay.
And so I have the upbeat tempo for the vibrations and the tapotement and stuff, but then I have the flowing music for the effleurage and petrissage.
Interesting. So it sounds like you're saying there's a symbiotic, that's not quite the word I want. Yeah, it's not the word I want. There's a meaningful parallel between the qualities of the music and the nature and quality of the strokes that you're doing. Yes,
absolutely.
Wow, that's really interesting.
And when I do scar tissue release, we were talking about this earlier, there is, like when you go on YouTube, you can say, oh, music for healing or music for pain, and it'll come up with like 852 hertz or 423 hertz or, you know, all these different things. And I mentioned that on the that we were doing online. And, you know, I don't know anything about chakras and all that. And, you know, that's for a different study, a different day.
No, it's not. No, that's not a study. There's no such thing. You don't need to worry about that nonsense.
But what I do know, what my personal findings after I started reading this paper that I noticed was that certain vibrations that are included in this music, and by music, I mean that it has this, like say the 850 something hertz tones in the background, and then it has the long flowing music that goes along with it. What I did find in scar tissue release is that when I play this music, one client reported that the vibration of the music felt better as I was working the tissue to release it, because the scar tissue release, all painful, it has painful components. Because the nerve endings are so sensitive and such. This particular client has amputations. And so I have tried it with a meditation, like a guided meditation. I've tried it with a audiobook, and I tried it with regular like spa music, and then I tried it with this particular kind of music. And he reported over and over again that the way that the vibrations from the music felt in his body as I moved, that he could feel it all over his body and it felt good. And I've had other clients that reported the same effect with that particular style of music.
So do you think that that is specifically due, excuse me, do you think that's specifically due to this frequency that is featured in the music, or do you think it's due to the overall effect of the music?
I think that with the scar tissue release, I feel that it is that particular frequency or style of music. I tried it with, since I tried the same modality across the board with these various clients, and I used the audiobook and classical music and spa music, and this, I'm going to put that in quotations, is frequency music. Across the board, they have responded better to that frequency music. Okay.
So there must be something, it sounds like there's something about that track or that style of music that works really well for that kind of work.
Yes.
Cool.
And I think that it would, and the study said that it needed more research, and I liked that they said that it needed more specific research. But I think that would be an interesting research topic. You know, what styles of music for pain, as we talked about earlier. You know, what are we going to find?
Yeah, I agree. I mean, research that gets at the components of music would be interesting. You know, so this study where they're like, let's see if music reduces pain, you know, like we were saying earlier, for so many reasons, that's such an imprecise question. I mean, what does that exactly mean? Because there's so many kinds of music, and when you get to sort of the more extreme types of music, people are going to start to disagree about what music even is, and musical taste varies so tremendously, and so yeah, you know, it gets really, really complicated. There is something, you know, we've kind of moved into discussing implications for practice, which is fine. You know, in my position as a researcher, there's something else I want to say about this paper for the benefit of whomever is interested in this. I found the pattern of effects that they reported to be too strong. I mean, my sort of gut response is I would definitely expect music to enhance pain reduction, assuming certain things are true, assuming it's music that is that people are receptive to, assuming it's, you know, music that isn't so extreme that it's going to cause discomfort in some people. You know, assuming certain criteria are met, it makes perfect sense to me that music would help with pain reduction. Now, having said that, there's 2 or 3 things about this study that I would view with caution. One is the effects that they're reporting are quite large, which doesn't mean they're not legitimate. But in my experience as a researcher, I'm a little skeptical that maybe in reality the effects aren't milder than that. And now someone might be saying, well, for, you know, why? What are you basing that on? And I would say that I think this study is probably vulnerable to publication bias. And this is a fancy way of saying that in addition to the studies that they report on, in addition to the 11 or 14 studies that they show us, here are the results, it's possible, perhaps even likely, that there are other studies that researchers have conducted that have shown poor results or no results, but have never been published.
Right.
And right. And when a meta-analysis is as small as this one, that only has about a dozen studies in it, if there was only one or two or three studies that researchers had done but not taken the time or effort to get published, or that they were unable to get published because there wasn't a result, if you were to average those into this meta-analysis, the effect would be greatly diminished. In other words, it would only take a small amount of counter evidence to change the picture a great deal. I think that's probably very likely. They show a funnel plot in the study, which is a way of trying to assess for publication bias, but it's not a very powerful technique when you're working with such a small amount of studies. I'm not gonna, if anyone wants to ask a follow-up question in my group or whatever about what is this funnel plot and how does it work, we could try to break that down. I'm not gonna try to do it here now. But it's not a very, it didn't make, it sort of doesn't, I'm getting bogged down here. Anyway, it's not a very powerful way of looking at this issue. I think this study is very vulnerable to publication bias, and that's not the fault of the researchers. They can only work with what's out there. But I think they should probably be a little more circumspect in how they view the strength of these effects, because 0.6 of a standard deviation is a big effect. Another thing that I thought was a kind of a limitation in the paper is they don't have much to say about the theory of how this will work. They say some very vague stuff about, well, you would expect that this would have to do with the way the nervous system works, and that processing music would interfere with the processing of pain. And that's all fine, and that all makes sense. But this study isn't really designed to test theoretical mechanisms. Also related to that, they don't really address anything about how music is used in the real world and how it's been used in history to reduce pain, which seems to me like it would be important. Is this something people have always done? What does it look like? They just kind of don't bother with that. And I think that's a limitation. I think it would give good context if they said, here are the ways throughout human history, or maybe just in modern history, that music has tried to be used, that people have tried to use music to reduce pain. I think that would be good.
Yes, I do too. I think that, if they had gone, there's a organization called, or a website called classicalalive.org. And what they do is they use classical guitar music in a hospital setting. And
performed live?
Huh?
Is it, you mean like performed live, like the guitarist goes to the hospital? Or is it music?
No, it's just music.
Okay.
Just recorded music, but they play it during the course of treatment.
Okay.
And I just learned about it. It was weird because yesterday morning I was driving in my car across town and I was listening to this, I think it was on NPR, and they were talking about this show, and they were talking about this. And so I briefly just looked at it, and there is research going on in various hospitals, including the Veterans Administration, about the effect of music on standard care, if they're playing music during standard care. And one of the researchers that I met with the Seymour for Mental Health Outcomes and Research through the VA, they were talking about this, getting this kind of research to test the effects of music on pain, because the mental health outcomes group, they're recognizing chronic pain, an inherent cause of depression, anxiety, so forth and so on. So they're looking at this, and that's one of the studies that we were talking about doing. And I thought that was really interesting that the hospitals are taking notice, and starting their own research projects.
Yeah, I think there's a great deal of interest in this for numerous reasons. I mean, music is one of the most popular things among humankind. I mean, it would be hard to find someone who doesn't care about music at all. You know, there are people for whom it's not so important and people for whom it's more important, but everybody responds to music, and everyone, you know, has some liking for some kinds of music. And then there's some people who are, you know, enormously passionate about it. So there's that. And then there's the fact that there's more interest than ever in treatment of chronic pain for so many reasons, including the opioid crisis, the fact that we have so many people and patients for whom chronic pain is a condition, including increasing number of veterans. You know, something else we should research is pet therapy for pain. Now, who was that you were just interacting with? Let's have a cameo here.
I'll show you. This is Molly. This is Molly Mae McWaggles. And it's, hi, Molly. Anyway, she's my rescue.
Nice.
It's interesting that you bring that up because
Which part?
She has a lot of, when we got her, she was in quite a bit of pain. She was literally starving to death, died quite a bit, and couldn't hardly walk. Well, she also, I guess, well, I don't guess, she's scared of the dark, and she gets quite nervous sometimes. Like right now, we are doing her a concern because she can hear your voice.
Oh, okay.
So, but she can't figure out where you're coming from. So when she does that, and when she was in pain when we first got her, because it was cold and wet and rainy, the little app I was talking about that I use for meditation with my clients at night to get her to settle down and calm down, she would start, what she would do is she would jump on my bed and get in my face and go with that terrible dog breath. Music on this app on, and within just a couple of minutes, she would settle down. See, like right now, she's kind of whining, so I'm going to turn on her music for her. And I noticed that her breathing would slow down. She would, that was a really cool thing that just happened.
Now, I got to warn you here, Tammy, scientifically, you're walking into a trap here.
Why's that?
Well, see, that's one of the really interesting things about music. While there's little doubt that human beings know what music is and responds to it, there's very little evidence that other animal species identify with music or respond to it. Now, there's some very rare exceptions, but, you know, using the example you're giving, if you play music to soothe your dog, we could, and even if we see that the dog responds, you know, gets more calm, changes its behavior when you play music, it's still an open question as to whether the dog is responding to music, and if it's responding to music in the way that we understand music. There's a bunch of alternate explanations for that, that possible effect.
Well, and I agree, because it's like, you know, we can't ask her.
That's one of the things with animal research is you can't ask them. Yep.
We can't give her a survey to, you know, or whatever.
But there are things,
all I can do is watch the effect that it has, which I turned on my little music. I don't know if you can hear it or not. Yeah. I turned it on, and she's over here just hanging out now.
Mm-hmm.
I don't know how it works. I'm not a researcher per se yet. I'm working towards that, but I know it does work for her.
Right.
I know that that this is her favorite. Other music does not work. My tribal belly dance music does not work for her. Country western music doesn't.
That's because she can't belly dance. If she could belly dance, it'd probably, you know, work.
It probably would. She probably enjoyed it if she liked it.
Yeah.
But this particular track of music is her comfort. And so, like a favorite toy or a chew toy or whatever, that's her favorite.
Interesting.
So I do what she likes.
That is the guiding principle with our dogs and our cats and our pets, for sure. Do what they like. I agree with that 100%. So let's move towards our conclusion here. We've already talked actually quite a bit about implications for practice, but since that is our last question, let's see if we have anything else we want to say about that. Was there anything that you derived from this research that you think has implications for practice, maybe beyond what we've already talked about, or maybe to reiterate some of the things we talked about? Implications for practice?
I would like to see which type of music affects, and I know that that's kind of an open-ending thing, but like we were talking about the scar tissue therapy, that this particular across, it's just personal observation is all it is. But across my own personal observation amongst my clients, this particular kind of music affected scar tissue therapy in this way. I would like to see if that is true of other kinds of music with other kinds of, say, is there a particular kind of music that affects, say, Crohn's disease? To see if people with inflammatory bowel disease or Crohn's disease or whatever could feel the same effect as my tissue therapy when I play that particular track of music. I don't know if I'm making sense.
If I understand you, it sounds like what you're saying is you would like to explore whether there are sort of matchups between pieces of music or types of music and particular conditions, with whether there are optimal kinds of music for treatment of certain conditions.
Yes.
That's an interesting possibility. Do you have any theory on that?
Not really at this point. I don't know enough about it to really have a theory yet.
Okay. But
do you?
As it relates to practice, you're actually already, do I?
Yes.
I mean, I don't have any theory off the top of my head. I mean, I can always develop some. I can always shoot from the hip and come up with some kind of crazy nonsense, right? I mean, what I would think about that, I'm gonna say what I was gonna say about your practice first, and then come back to that. I mean, in some sense, you're already doing that. So you described the process, sort of the trial and error process by which you found some music that you described earlier, the stuff that is like centered around a particular frequency. And you noted through trial and error that music seems, for you don't know why, but that seems to work really well for that particular kind of treatment and that particular kind of condition. So you're already starting on that process. So, good for you. And so as you practice, you might start to see general patterns that certain kinds of music are generally better for certain kinds of work, which I think that makes sense.
Yeah, I think we need to, as massage therapists, start paying attention to that and not just sticking 6 CDs in a CD changer and just playing whatever comes on.
Yeah, no, I agree. I think being mindful about music selection and thoughtful about it makes a lot of sense. And, let's make sure that we are noting it's not simply the effect on the patient or the recipient. That might be the first thing we think of. Like, what kind of music do we want to help this person relax? Or what kind of music do we want to help this person feel comfortable? But the fact is you're subjected to the music too. And,
yes.
You noted the tempo of the music influences how you work. And if the music is something you hate or you've heard 5,000 times, that's going to affect your mood and that's going to affect the work. So ideally, the music would be something that matches the condition, that is pleasant or at least tolerable to everybody involved. And if it goes beyond that to the fact that it's stimulating or inspiring or produces whatever positive effects, I mean, that would be ideal. So, we've got to think about not just how it affects the recipient, but also how it affects the treatment provider. You asked me about theory. I mean, what I would say is I would get back to kind of the theme we've made so many times here, which is music is enormously complicated. So if we found that people generally responded to a certain kind of music a certain kind of way, that doesn't necessarily tell us how or why. So so I mean, just think about cultural differences, for example. Think about how much different music from one continent sounds than music from another continent, especially if you go back in history when, before the internet existed. I mean, now you hear, music blends and things spread so much faster. But if you think historically a little bit, music from different parts of the world can sound radically different. And so what people are familiar with starting off is different. if we play a piece of music for somebody and we see it affects them in a certain way, we still don't know why. We don't know if it is because the music has a certain tempo. We don't know if it's because it's got a certain kind of dissonance. We don't know if it's because they respond to the lyrics. We don't know if it's because it's something they're really familiar with. We don't know if it's a combination of all those things. So, anytime someone says music has blank effect, I'm very skeptical right away, because one of the first things I think of is like, music's really complicated and it's really hard to define, and it's going to affect different people differently for all kinds of reasons. So, I'm not so much developing a theory as I'm developing an anti-theory, here. Like, it's almost impossible to theorize on. And even if we were to develop you could even come up with ideas that on the surface sound plausible, like, oh, well, if you want to relax somebody, you want to play music that's at a very low tempo, like maybe something that matches resting heart rate, right? You might say that, and we might all sort of knowingly nod and be like, yeah, that makes sense. But wait, the fact is some people, some people find it very relaxing to listen to aggressive music or really fast music, right? They find that relaxes them. And there are good reasons why that might be the case, some of which have to do with familiarity and cultural context, but others as well. So I guess what I'm saying is coming up with a theory of how music affects people is extremely challenging, and there's going to be so much individual variability that it's going to be hard to come up with a theory that is widely applicable.
Yeah, and again, as we were talking about, or as you mentioned earlier, that pain is subjective. You wait long enough, it'll go away. What I do like about this study is that they limited the time to like 20 to 30 minutes. They would expose their 30 minutes music. So at least it wasn't like, well, this person was listening to music for 3 hours and this person was listening to it for 10 minutes. Yeah. That was a good strength to the study that I just now thought about. My leg may be in terrible pain due to arthritis or whatever, but with or without music, as you mentioned, that pain may go away in 10 minutes.
Right, or reduce for a variety of reasons. Maybe it doesn't even go all the way away, but it's gonna change across time for all kinds of reasons. Yeah.
Right. So it would be almost impossible to really measure, in just a short period of time, have that effect. Now, I will say from personal experience in dealing with palliative care patients who had a variety of issues, including trauma and obstructive bowel disease and very cancer, I did know that music, as compared to static noise like a television playing, did seem to have a better effect on their level of pain.
Your sound dropped off. A couple times there, and I didn't quite understand what you were saying. Could you repeat the?
Yes. So in palliative care, clients who had cancer, just terrible pain, chronic pain, we oftentimes they would have static noise like a television playing in the background. I did notice that during times when they were in a lot of pain, I would turn off the television and turn on whatever their favorite music was. And they reported a decrease in pain. Now, I know that anxiety, when you've got a television show that's just yakking, that can get on your nerves after a while.
Oh, it's funny you mentioned that, because I was talking about that just the other day. I had to go to a waiting room yesterday, and I was dreading the fact that there was probably going to be a loud television in there, as there is in every waiting room nowadays. And some people aren't bothered by that. I'm the kind of person who's just like, oh my God, like, that drives me crazy. Yeah. So, yeah.
And so my patients or clients who were experiencing this chronic pain, the yakking TV can increase anxiety, which, can increase pain perception. And so we would turn off the TV and turn on whatever their favorite music was, and they would report that they were feeling better, that their pain had reduced.
Mm-hmm.
So if you compared it, with a yakking television or static noise like that, well, yeah, but then again, is that because their anxiety level was increasing, so perceived pain was, it's
Right.
hard to say.
Well, it's real hard to say. I mean, and what you can address questions like that in controlled research. The problem being that the more you control it, the less directly applicable it is to the real world. But I think you bring up one other interesting point in mentioning that relates to this music thing, which is it's even the case, more than ever in this technological world that we live in, that silence might be good for people in terms of relaxation, that we very rarely encounter something like true silence or stillness.
Mm-hmm.
And yeah, so and if you're in a hospital, there's TVs going, you might have a roommate who's making noise, there's machines whirring, there's constantly people coming in and checking your lines and your machines and stuff. And this is one of the reasons that why it's more profound than ever to reconnect with nature. You get out of the city and you get to a place where there aren't people and there aren't machines. And it's only then that you sort of reconnect with just how quiet it's possible for things to be. Because for a lot of us, day to day, we've gotten so accustomed to a certain level of buzzing and noise and distraction in the world that you can forget what it's like for that to not be there.
Right.
And yeah, and the fact is this can be raising your level of arousal and therefore causing anxiety or exacerbating pain without you even realizing it, because it's been so long since that noise and that irritant hasn't been there. So you can lose sight of the effect that's having on you. But it's still maybe having the effect because it's being processed, outside of consciousness.
Right.
So I think what we've determined is that this whole area of research is way too complicated, and it's just way too complicated.
It is.
But, one of the people in one of my discussions the other day, it was Odette Wood, who's someone I'm recently acquainted with online, glad to make her acquaintance. One of the comments she made was along the lines of, I don't want to misrepresent what she said, but it was along the lines of, well, we know music, makes people feel better and thereby reduces pain.
Mm-hmm.
And I'm normally disinclined to agree with statements like that as a researcher, but in this case, I mean, I can get on board with what she's saying. Music's been around as long as it has, which is basically forever, as long as there've been human beings, because people like it and it changes the way they feel. I mean, there's no doubt about that. We don't need a research study to be certain of that. I mean, that's pretty obvious. So the question really becomes, how effective is it? What aspects of it work in what ways? I mean, the question as to whether people respond to music and whether it can have beneficial effects on them, I mean, I don't think there's any doubt about that. And I think for those of you that are practicing, it's undoubtedly the case that, being smart about music and the therapeutic effects it can have and how it can add to the context and quality of what you're doing is absolutely worth considering.
Yeah. And Cody Dulitsky, on the comment thread, brought up some interesting points that I think would be good, to address. One of them was, the first one he said was, tempo of music should be slower than heartbeat in order to induce relaxation. Does the same hold true for addressing pain? And I thought that was a really good, we addressed it, about tempo and how, some people may be more relaxed by Norwegian death metal than, soothing ocean sounds, or like me, tribal belly dance music relaxes me more than ambient music.
Yeah, I think that remark, I think it's a popular misconception that, tempo, if it matches heart rate or is similar to heart rate, might produce a kind of entrainment effect. Entrainment being this idea that something in our body can sync up to something in the outside world. There are entrainment effects. There are possibilities for us to sort of tune in to things that are going on in the world. It's going a few steps too far to expect that our heart rate would entrain to the tempo in music. And there's a number of reasons for that. I mean, think about if that was really true. Think about some of the problems we'd encounter. If your heart rate adjusted to the tempo of sounds in your environment, that could put you at risk. Your heart rate is, I mean, what you could have is if music's relaxing, it's going to tend to lower your heart rate. If music is stimulating, it might tend to increase your heart rate. And that's just a generality too. There could be exceptions to that. But if your heart rate adjusted to match the tempo of things in your environment, well, if that was the case, I could be killed by walking outside when someone's operating a jackhammer, right? Because suddenly my heart rate would, match the tempo of the jackhammer and I'd have a heart attack or something like that. Now, I'm being a little bit facetious, obviously, but, what does entrain are your auditory nerves. Your auditory nerves entrain to the music you're listening to, and that's how you're able to perceive the music in your mind. So I think everything we've talked about sort of takes us away from tight specifics, like, well, for relaxation, you want a beats per minute of, 72 beats per minute or something like that. I mean, I think we can rule things like that out and think more broadly about, how does music in a certain cultural and treatment context affect people generally?
Right. And the other question he had is, is this pain as a analgesic? He says, is it a psychosomatic experience or is there a physiological endocrine response to music? And that's an interesting point as well, because he kind of pointed to this, that, the music that the patients or that they favored, when they chose their tracks, that the effects were greater, when they were familiar with it and whenever they chose their own music, than chose. So I would dare to say, and it talked about that at the beginning of the study with that downward modulation, that it talked about that, when we're familiar with it, then already we have the expectations. We already know that we like this music, or we expect this music will make us feel better. So then therefore you get the psychosomatic effect where, of course, you're going to feel better because you expect to feel better. It's kind of
I would say there is not a line there. I would conceptualize it differently. So, or more correctly, I think it's a bit of an artificial line to say that, the dichotomy that seems to be set up there is the music affecting the person biologically and therefore in reality, or is the effect psychological and therefore somehow less real? That's a little bit what that dichotomy sounds like to me. Before I go further, am I off base? Am I missing the point?
No, you're getting it. That's exactly what we're trying to address here. Is it an actual, biological thing, or is it a psychological thing?
Yeah, okay. And I think that's the wrong way to think about it. I think that's actually scientifically completely inaccurate. I think that what we know more than ever in modern times is that everything psychological is biological. There is no psychology without biology. And so if we listen to music, which we all do, and it affects us, how is it affecting us? Is it affecting us biologically? Or is it affecting us because we process it mentally? Well, the fact is the only reason we can process it mentally is because we're a biological entity. Everything that we think about, everything that we feel is grounded in our physiology. Now, there are two pathways there. We can do something to the person that will affect them physiologically. So let's, again, use an extreme example. When you go to an extremely loud concert, and it could be classical music, it could be Metallica, but I'm talking about where the music is so loud that you feel it, right? Mm-hmm. You feel it vibrate your body. Okay. before we even consider thinking and listening to the music, thinking about it, it's going to have a physiological effect on your body. It's going to stimulate you because your body's being moved and we're not used to being in such an intense environment. And so there's going to be a direct physiological effect. Even if you couldn't hear the music, in some sense, your body is being moved by it. But your body is also going to be affected by everything that you perceive about the music. And that's all biological. That's not real because it has to do with your experience and your expectations and your interpretations. That stuff is all still real. It's just a different pathway. To put it into terminology that scientists like to use, one is a bottom-up process and the other is a top-down process. Right. So bottom up, your body is being affected and that affects your mind. Top down is what you're doing affects your mind and that cycles down to what's happening in your body. Both of those are real. One is not any more real than the other. And they're also, at a basic level, they can't be separated. We can conceptualize them differently, but ultimately they go together and they can't exist without each other. So I don't know if I'm speaking about this as articulately as I would like, but when we listen to music, all those things are happening and they're happening together and they're interacting with each other. So, if we wanted to measure the effect of music on someone, could we do that by examining its effect on their endocrine system? Absolutely. We could try to do that. We could see if it changes their stress hormones. We could see if it changes the rate and way in which they process certain neurotransmitters. We could totally do that. Would that capture the effect of music on a person? No, it wouldn't even come close to it. It would capture a small part of it, but music is a psychological experience, and we're not going to capture the complexity of that only by looking at its effect on biology. To put this another way, we can't reduce everything about psychology to biology, even though we know that everything psychological has to be rooted in biology. I say we know that. I mean, we know that if we have a materialist standpoint as scientists. Some people do not espouse that standpoint. Most modern scientists do. Almost all modern scientists do. But that's not to say that there aren't other philosophical stances. There are. But from a scientific standpoint, there's not much you can do in modern science if you are going to take a non-materialist standpoint. Well, you know what? Now we're going to spin off into, you and I will be talking all day if we start talking about that. But I guess the point I'm trying to make is, if something is psychological or psychosomatic, that doesn't make it not real. Right. It might make it harder to conceptualize. It might make it harder to measure in a research study, and you might need to use a different set of techniques drawn from psychology rather than biology. But it doesn't make it not real. And yeah, I think expanding on that subject is a whole other subject for another time, but maybe that's a good place to leave this.
So to answer Cody's question, it's not one or the other. It's not psychological or biological. It's actually both.
Oh, I would say so. I mean, music, certainly. I mean, there's no way to listen to music just biologically. Right. If you think about something else, if you think about something like taking a drug, you can do things in a research study to ensure that a person's only affected by the biological portion of a drug, right? You can take steps to administer a drug in such a way that the person is not aware that that's happened. Now, some people might be like, that's unethical in research. I mean, yes, there are ethical dimensions to that, but the fact of the matter is it's conceptually possible, and it's even been done in certain kinds of research. So it's possible to measure the biological effect of a drug separately from the psychological effect of a drug. I don't see how you could ever do that with music. I don't see how you could ever deliver the biological channel of music without delivering the psychological channel of it. I mean, music is inherently psychological.
Right.
Would you agree?
I do agree. Absolutely.
Yeah. Okay. Good. Then we're both right. If we're in agreement, we've got to be right.
Right?
Tammy, I want to thank you so much for taking the time to do this. You've really modeled something for progressive massage therapists and being willing to take on some research and talk about it with me and put yourself out there. So I really appreciate the time and the effort and the interest that you have given. So thank you very much for a great job.
Thank you so much for having me. This was a blast.
I'm glad you enjoyed it. That's terrific. We'll have to do it again sometime.
Yes, sir.
All right. No, you can't call me sir. We covered that at the beginning of the program.
Another thing.
My name's Chris. All right, Tammy. Well, you have a good afternoon, and we'll see you next time.
You too.
Take care. Thanks.